Hi, I'm Dr. Herman, and this is a great patient. This is Charlene, and she comes to my clinic from Canada, down here in South Florida, the United States, where we are at this point. And we're just here to share a series of symptoms that are greatly reduced after her first. It was a little more than a 2-month protocol that you followed, and there was a great reduction in symptoms. And some still remain right now, so this is not the end of the road of the chronic conditions that she came for. So we just want to give an update on how much improvement she's had and share with you that you can actually understand that when we peel away the different layers of what causes the condition, the hidden infections and toxins, we can see the symptoms that have plagued you for months or years start to just lift and be relieved from your body. So Charlene, one of your symptoms was you had a problem with tingling in the arms. That was pretty constant before?
Yes, what happened was that my shoulders and my neck were sore, and it would go down my arms and they would tingle.
Mm-hmm. And that was pretty constant throughout the day?
Yeah, sometimes were worse than others, but yes, it was pretty much all the time.
Pretty much all the time. And now, is it every day at this point now?
No, not at all. Every once in a while, my shoulder starts to hurt, and then it'll be tingling, but it's much reduced and doesn't happen very often. It maybe happens once every couple weeks now.
Once every couple of weeks instead of every day. Mm-hmm. And the severity of it, so the frequency is great reduction in the frequency, and the severity of it
is a lot less. It's a lot less. I would say at least probably an 80%.
80% reduction in the frequency and severity. Mm-hmm. Excellent. So that's significant.
Very
long was
much.
that? How long were you experiencing that tingling in the arms and hands for? How many months or years?
Well, it's been off and on. I've had chronic problems off and on for a couple of decades. Mm-hmm. And fortunately, everything doesn't happen at once. But I've had that particular thing off and on for many years.
More than a decade?
I would say, yeah.
And so the reduction is great to experience.
Yes,
yeah.
It
is.
is.
It's going to be totally gone.
Yes.
The more that we take out of your body from these infections and toxins, the more it's just going to be gone. You had another symptom of a problem with climbing the stairs. So that was what? It was legs were heavy or weak or painful, and the shortness of breath?
Yes, my legs would feel very, very heavy and weak. And yes, it was hard to breathe.
Didn't matter how many stairs you were climbing. Could it just be like 3 stairs you felt the challenges, or did it have to be like 2 flights or 3 flights of stairs?
No, maybe a half a flight of going up.
Like 6, 7
yeah,
stairs.
6, 7 stairs, and I would notice.
I'm sorry?
6 or 7 stairs, and I would notice it.
And you would notice it. And now, after your first protocol, the out of breath feeling, which I think you told me in the severity scale of 0 to 10, 10 is the worst. That was about a severity of a 9. So now
I don't get out of breath climbing the stairs.
Excellent.
Anymore.
100% relief of that.
Yes, and overall, my breathing since this protocol has improved tremendously.
Excellent. And one of your practices was, when you were going to bed, what did you say that you used to do to prep yourself to try to breathe better?
The Vicks Vapor Rub every night, but now I don't have to do that.
Excellent. And how many months or years was that experience of the shortness of breath, the breathing condition, and the Vicks Vapor Rub?
The breathing with the Vicks Vapor Rub has been about over the last year since I had the problem with the anesthetics.
Mm-hmm. After the dental work.
Yes, yes. And but throughout this couple of decades where I've had chronic problems, I've had lots and lots and lots of sinus problems, lots of breathing problems. Not every day all the time, but sometimes it would be really bad and sometimes it wouldn't be there.
And now you're noticing a definite, you can tell the difference of now as opposed to
Yes.
As opposed to when it
Oh,
seems
yes.
like it's more severe and less severe in the
Yes,
past.
because I can breathe better.
And the other part of walking up the stairs was the heaviness in the legs. That was something that was a constant issue for you walking up these stairs. And now?
Now I can walk up one flight and not be like really tired.
That's good.
Yes.
No heaviness in the legs, you told me.
Yes.
The bad pain that you had in the head and the neck. So now after your first, well, let's go back. Going back before we started care together. Let's go back to like June of midsummer of 2018. This is now February 11th of 2019. So let's go back to the summer of last year before you ever started with me. That bad pain in the back of your head and neck. How severe on a scale of 0 to 10? 10 would be the worst. How severe and how frequent was it?
It was every day, and especially in the morning, first thing in the morning, it would hurt. And I would say that it was like an 8 or 9. And
was
every
it
day.
constant? And constant throughout the day, or did it fluctuate?
It would fluctuate, but always first thing in the morning. And then sometimes it would be gone then later in the day, or sometimes not. And that doesn't occur.
Not occurring. So you wake up in the morning and there's
no pain.
Wow. How great is that? So that's like near 100% relief of this symptom. That's phenomenal.
On that one, yes,
And there was
absolutely.
no therapy to your neck. There was no physical therapy. There was no massage. There was no acupuncture. There was no pills. There was no medications. There was no chiropractic. There was no treatment to the neck.
That's correct. And I had those type of things for years and years and years before.
And you still suffered with it.
Oh, yes.
And how many years did you deal with this head and neck pain?
I would at least 20.
Wow. And how many days or weeks has it been since that you recall that you've had the relief of this decades of symptoms?
It went away after about the first 3 weeks
First
of my
3 weeks of the protocol.
Yeah.
And that protocol was a little more than 2 months in length. So now it's been gone for probably
For about a month or 6 weeks, maybe.
Phenomenal.
Yeah.
Excellent. You also said that your mind feels better.
Yeah, I'm just generally feeling calmer, much calmer, and happier, and moods are much more stable and appealing.
So there was more mood swings that would happen, just not feeling so good. So that's good. Appealing is a nice word. I'll ask your husband, I'm sure he'll say the same. You also had the rash on the hands that was pretty constant and chronic, and also that made the hands swell. The rash added some swelling too. So it was on both hands or one hand?
Both hands, but the right one was worse, and then it got on my neck, and for a while it was on my chest, and also the inside of my elbow.
And so now the rash on the hands is?
It's virtually gone. If I really feel it, I can feel a couple little bumps, but there's no swelling, there's no burning, there's no...
Well, we didn't talk about that symptom yet. So, but from the rash standpoint, we're going to get to that. I'm glad you brought that up. But the rash standpoint, the rash and the swelling of the hand is gone.
It's gone.
And what about the elbow?
It's gone.
That's gone. And from the chest, I don't see.
The chest is good.
A little bit of the neck.
But the neck is still a little bit.
A little bit.
So
but there is some
still-
relief of it, but we still have some more to go.
Big time.
Big time.
relief.
So a little bit. So how much relief for the one on the neck do you say, percent?
I would say that it's like 70% gone.
How long have you had these rashes for?
Really, over the last year since I had the anesthetic problem, that is when the rash came in full force. But I remember having the rash on my hands as a child, and also certain times in my life when I was stressed and sick. Then it would come and last for a couple years. And as a child, it lasted for several years.
So we're pretty happy that's gone.
Oh, yes.
Also, let's talk about the hands burning, the stinging and burning. That was also happening stinging in both hands. Now,
Mhm.
how long did those stinging and burning in the hands, how long did you experience that for?
It's this past year, it was stinging and burning every day, and when I would put my hands in water, it would sting and burn, and also
More. So you had the stinging and burning, you put them in water, and that would make it worse? Or
Yes.
that would just
it would make it worse.
Did it matter if it was cold or hot water? Did that matter?
No, any water, and even having a shower. And so I would have to wear gloves, you know, all the time if I wanted to be in the kitchen. And so that is gone, and it would burn so badly that I would put ice packs on it, on my hands, on my chest, on my neck. And so that's gone.
Wow.
So happy woman
excellent.
about that.
That probably has got to help you reduce some of the mood swings.
Oh yes, and it used to come on actually at night when my hands weren't in water or anything. Like I'm just trying to sleep and my hands would just burn.
Wow. I'll be sharing about what kind of test examination findings and protocol that you went through to get this relief. You also talked about a chest pain, something that you even forgot to mention when we first started in our first consult investigation appointment. That never came up, but now you remember because it's gone.
It's gone.
How long did you have that for?
You know, I think that I felt that heaviness and that just a soreness for a long time. And then after a certain remedy, I could feel a difference that day, and then after that, I have not felt that. It was right here.
Incredible. And that was the Lyme disease in the aorta.
Oh,
That's
it
what
was
you found.
that.
That's what that was. That remedy you took and that disappeared. So that's phenomenal.
Mm-hmm.
That was a great surprise for you. The coldness, another symptom you suffered before coming here. Coldness in the body and the hands and the feet. And that, how long did you have that experience or that freezing kind of feeling for, cold feeling? And that would happen not just in cold weather.
No,
That could happen
just
in summer,
any time.
Anytime.
Probably 20 years.
20 years of a cold feeling.
Mm-hmm.
And so how long has it been now? And this protocol is the final breakthrough for you,
Yes.
this care, this treatment. So how long has it been since you felt the cold body or cold hand and foot feeling?
It probably went away within the first couple weeks, I would say.
So
Yeah.
we're looking at least more than a month right now of
Yeah.
the relief of this. So it's been
Mhm.
sustainable,
Mhm.
consistent relief. So again, we talked about the breathing being better, no more Vicks Vapor Rub at night, and your throat soreness. That was another symptom that you suffered.
Yes, my throat was so sore, and sore to the touch, sore coughing, just sore. And it's not sore anymore.
Is that 100% relief of that experience?
You know,
When you say
I
not
would
sore-
say like it's like so close to 100.
Okay,
It would be definitely 97.
excellent. And that's phenomenal. And that's been
Yes.
years with that. And so, there's been zero use of any kind of throat lozenges or anything as a throat kind of medicine of any kind in the store. You're not taking anything like that. You're
No.
just following the protocol that we designed from first exam together. So these are all great improvements. One more, I'll say that you have, because you also had legs hurting, well, two more we're going to talk about. Legs hurting, not the heaviness of walking upstairs.
The burning.
But the burning in the legs. And now, but it shifted into another symptom, another kind of sensation. But the burning in the legs, you had at night this really bad pain.
That would be if I did anything during the day, had some type of exertion of energy, and it wasn't much. And then at night, my legs would just burn from the inside, and I haven't had that burning. The burning is gone. Like, you know, and I don't have a lot of energy, so I'm not doing very much, but if I did,
But you didn't have the energy before, so
I
there
didn't
wasn't
have the
much that
energy.
you did before.
No,
So
I-
now,
no.
even though, and that's the last thing I'm leaving for the end about the fatigue, but the energy was down before, energy is down now, even though symptoms, a lot of symptom relief has
yes.
taken place and mood is better and so on. But with a low energy, with the fatigue that you've had for a long time, you weren't it's not like you were going jogging or
No.
running or what you
No.
were going on long walks.
No.
So even still with a little bit of exertion, with the little bit of energy that you've had with this fatigue issue, you had the burning legs already.
Yeah,
So
but
you're still
it's-
doing about the same kind of activity.
Yeah, and it's gone.
Okay.
So,
But
so
now
that's
it's a little bit of
that-
some other hurting that's in the leg, but the burning pain is gone.
Right.
Excellent. Now the fatigue is the last. So with all of these improvements so far, all this relief, the fatigue is still remaining. Might be like a point less, but it's still.
Yeah, it's somewhat less.
Mhm.
Like I get out of bed every day.
Mhm.
So that's an improvement because this past year there was days where I didn't.
Okay. I didn't know about that being that bad.
Yeah, like for a month I didn't get out of bed. And now I get out of bed every day. I have a shower every day. I get dressed.
So there's a little bit of improvement there, even though we still have the fatigue.
Hmm.
I don't know about the leaping, tolping buildings in a single bound, but we're going to try and get there. So right now within your first protocol, and you found me through videos of mine online,
Mhm.
that's what propelled you to come here, besides being in pain and suffering, say I've got to figure this out because a lot of things you've tried did not get you better.
As soon as I got out of bed,
Mhm.
I started looking really, really hard, even more so, and to try to find something, and then I found you,
And it made sense.
and it made sense.
Mhm. And I don't even talk, but even with it making sense, there was not much that I don't tell how I do what I do. So there was still a little bit of a mystery that remained until you came here and actually could see it and experience it. So your fatigue level on a scale of 0 to 10, if 10 is the worst, this chronic fatigue issue, 10 would be the worst exhaustion. What is your level of fatigue?
I would say right now it's only about a
That's
6.
6. And before,
It was 10.
it was 10. And has
Mhm.
it been pretty much a steady 6? Does it ever get
Yeah.
worse or better right now in the past few weeks?
Sometimes it gets worse and better. Yes, it's not.
It's not 6 constant day
No,
in it. Okay.
no.
All right, but we're going to overcome that too, and we have more amazing findings that I'll be describing soon. So we're going to get over that too. I thank you for sharing these. You stay tuned to watch the next video. You'll hear of the really incredible in-depth examination findings that are where I discover these hidden, unique disease-causing infections and toxins that are in specific tissues, unique to each individual. And until you can actually pinpoint these infections and toxins that are hidden in various tissues, until you can find them and actually have a great remedy to remove these different hidden infections that are causing such debilitating conditions and symptoms, until you can get them out, you're going to suffer with them. You're going to suffer with the symptoms for a long time to come, unless you're lucky and find some lucky type of, some supplement or something that's going to aid you. So this is what's been done for you. Stay tuned, watch the rest of the video, and I do thank you for at least getting on here now to share this. And this is in no way have we said you're 100%
welcome.
recovered. Thank you, yeah. And they're going to thank you too. But it's no way are we saying that you're 100% recovered.
No.
Yet there is significant improvement. And maybe next time you'll be brave enough and sweet enough to come on and say, when I'm really improved, when you're really improved.
I
We
will.
can have an update then.
I will.
All right. Thank you. Anything else you want to say?
Well, that's everything.
That's great.
Thank you so much.
You're welcome. My pleasure.